As a nurse who works in the ED of a large metropolitan hospital, we have patients who repeatedly visit for one reason or another. What do we call these patients? Frequent flyers. But there is one thing a nurse must never do in order to remain engaged and caring with each patient that you care for. What is it? Make a judgment about your patient. The problem is that when an assumption is made and label them a frequent flyer, for example, you see them differently, and it is next to impossible to engage and truly care for this patient as a person. Nurses care. A nurse who ceases to care becomes a caricature of the profession. Think Nurse Ratched in the classic Jack Nicholson movie, One Flew Over the Cuckoo's Nest. Have you ever received a loaded report as a nurse? This happens when you had a bad shift with the patient and may have been difficult or even sexually inappropriate, and the nurse communicates very clearly what a horrible shift you are going to have. You must now make a decision. Do you assume these assumptions and make them your own? Or do you avoid these assumptions, approach the patient with a clean slate, and make your own judgment based on your interaction with the patient? Though I know this principle to be true, I did the one thing a nurse must never do recently and learned a valuable lesson. I was working in the ED and paramedics brought in a patient who called 911 because of vague complaints of feeling out of her mind and not quite there. Her symptoms were intangible and difficult to interpret. She had a history of an anxiety disorder, and as I received report from the paramedics, it was obvious they too felt this was much ado about nothing. I too made the same assumption, my own, and thought her problem was likely nothing more than a case of anxiety related to her disorder. But as I completed her initial assessment, she remained anxious, and as we talked, she shared why she was so concerned and decided to come into the emergency room despite the vagueness of her complaints. Her husband died unexpectedly 5 years ago because of an intra-abdominal aneurysm that was just a vague abdominal pain, then proved to die. Then she had a brother who also had generalized upper back pain that turned out to be an aneurysm that ruptured, and he too died suddenly and unexpectedly. It became clear that she had a reason to be concerned about these generalized complaints that turned out to be life-threatening to those whom she loved. What do you do to keep yourself from making assumptions as a nurse? I'd love to hear it. Post a comment on this video and share it for all to see. Then like this video and share it with someone who would benefit. If you haven't already, subscribe to this channel to be first in line to get fresh content that can help you get practice ready as you pursue your passion to be a professional nurse and never make those assumptions about your patient.